Hi guys, welcome and welcome back to my channel. For those of you who were new here, so I would like to say that I am educated as international nurse and I'm here in Canada pursuing my nursing. Right now, I just ended up with my NCLEX exam. It goes well. I passed and that's the big news. So today I'm here to share with you my experience, like how I found the exam and what I actually studied. And to be honest, I didn't go for any kind of tuitions, any kind of coaching or anything. Yes, but I did took my Archers, my UWorld. I completed all the question banks, which we will discuss later. And most of all, like when I reached the exam center, I would like to share a little story. Like when I reached the exam center, I found it a little bit nervous. Like I found myself nervous, and then I thought it's okay. Let's do this. Let's do it today. And if I didn't pass, I will try again. I had this attitude when I entered the exam hall. As soon as I seated on my computer screen and I was like literally first question came up and the question was easy, but I was finding it difficult. Why? Because I was over analyzing. Oh, am I doing it right? Am I thinking right or no? What's the rationale behind it? And there is one trick that I followed throughout my exam uh, that was just eliminating two of the options which were very evident. If you practice good and if you practice a lot of questions, like I have practiced around I think 5,000 questions. Yes, I 2,500 questions from Archer. I completed that, and as well from like I completed Archer for 100%, like 200%. I completed it. Then I moved on towards my UWorld, and UWorld was something which has some questions. I found it easier. Why? Because I already completed my Archer. I just like cram all those videos. I watched all those videos from the Archer. It was so helpful. I don't know who say that no, you can skip the video. No guys, just follow through. They have a plan as well. I didn't follow the plan. I didn't go with the plan. I didn't follow any of that, study plan, but I created my own. I was working while I was preparing because I cannot take any kind of break in between. I'm living here. I have to look after my expenses as well. So I didn't took any break, but I was just doing one by one after one after one, just like one video and one question set. That's it. Like for a day, it is enough for me. I did 75 questions every day, and that's how I end up completing 2,500 questions from the Archer. And when I completed Archer, I my scores were, they have the level, the low, high, medium, and very high. I was on the low part when I was just started my Archer, but when I completed it, I was between high and very high. I used to get like three consecutive high and then maybe one medium difficulties, and then I borderline. I found it myself like, oh my God, I'm going down. Why? But don't stress that out. It's okay because they gonna test you according to your difficulty level, so it's nothing to do with that. Don't look at like, oh, I got the four consecutive high, so I will pass the exam. No, the opposite can happen as well. So whenever you started preparing for the Archer, just keep some points in your mind, and I listed those points as well in here. I'm going to tell you. So let's get started with Archer first. So when I was trying my Archer, I was completing my Archer question bank, then I realized that most of my scores were like falling into the low category. Like I cannot pass. They said that, and I was very nervous because I didn't expect that, oh, after doing these much set of questions, like 15 question bank, after 15 question bank I'm gonna get a low. Why? Where I'm lacking, right? So I just started it, and I didn't even look at like what they are saying, borderline, low, very low, high. I didn't care about that for a particular time, for a particular period, because I was so distracted by my scoring. So I thought, okay, let's do this. Let's understanding the question. Basically, my intention was to understand the concept, like why they are saying this and why this question is coming up again and again. It means it is something, it is important. So I just prepared a list of some topics that I was seeing on my question bank again and again, like epiglottitis. There was a lot about the rheumatoid arthritis, and some about medications, like psych medications. Oh my god, there were so much on my exam too. So do focus on this psych medication because they were a lot. They were a lot on my exam. So I did those things which were important back from the Archer. So I did it. Then I completed those question banks with 100% of like using them, and I didn't go for any reset. Instead of, I thought, why not try UWorld now? Because I already know the questions. I already know how they are questioning me in Archer. So why not try UWorld? Because everybody was saying, oh, UWorld is good. It is greater than Archer. You should try this. You should try this. So I went for the UWorld, and I just took 1 month of subscription. I think somewhat about $120 or something. So it was about that one self assessment, and that I have to be completed within the 15 days period. So I got one of that and just questions and all. So I started doing my U World, and as I started, I thought, oh, these questions seem so easy as compared to Archer. But I love the rational. There is no doubt that you will prepare you with a good rational, because it will show you a lot of things. Like it will give you an in-depth explanations, which it is known for, right? But I found Archer more structured, more organized in terms of content, in terms of like how you should start. Because in when I started watching the UWorld that videos, I found it very very vague. Like you can start from there, you can start from here, you can start from anywhere. But in the Archer, you will get a one-to-one. Like first you will complete all the organs systems, and then you will find yourself into the medication, then maternity, then OBG, then ops, pediatrics, these safety and concern, and comfort, and these things. Like it is very structured in Archer, I would say. Like, oh, they have good videos. But UWorld is good. It covered all the topics. It covered the essentials, like what is more important in terms of exam. So yeah, whatever you feel right, you can choose that as well. So I completed UWorld around like 60%, and my percentile basically was 40, less than 47. They said 47 is the median. Like you have to have like at least 47 percentile to go through this exam and pass it. But no, this was not the case for me. I was falling below 47. I was, I think, when I gave my exam, my percentile was 28 or 38 something. Yeah, it was something in between, like 28 to 38, something like that. So I was not even an average percentile. Like I was not a medium percentile, as that they called. So I was so worried because I have already booked my exam for the 4th of September, and I thought, I already booked. I cannot cancel it and do it again. No, I think I'm prepared enough. I think I have done 5,000 questions, so I think I'm prepared enough to give this exam. I took the self assessment, and in self assessment, I got the high scores. That boosts my confidence for sure. So, moral of the story is like, even if you feel confident enough, don't let your like morale go down, because in the end you will know, like, okay, I'm prepared enough or no. Your intuitions will guide you. So follow your intuitions and give this exam. It is not like very hard, because on the exam day I find it complicated, a little bit complex, but I cannot say like it was so hard. It was complex. It was very complicatedly questioned. Like I can say, if they wanted to know the anatomy of ear, they won't say directly to you like, okay, tell us the anatomy of ear, or maybe question one. They gonna put one questions about like how many bones or which bone is important for hearing and producing vibrations. They don't say that. They just ask you, in the adult it is more horizontal, in pediatrics it is more vertical. It's like that, it's like that. So I got the questions on otitis media and I was like, oh my god, this is so easy topic and why I'm not able to recall it. So just use your common sense and you'll be fine. So this is the exam tip that I can give you, I think. And the resources that I have used, I have already covered in this video. Like Archer, I've used for first, and I prepared my base from the Archer. I will not give credit to any book, no. And I also completed UWorld, like half of it. And other thing, yes, one thing that is most important that I've learned a lot from is Dr. Sharon's video. It was in the Mark Klimek. When you type on your YouTube like Mark Klimek lectures, it will show you Dr. Sharon's video, because those videos were so good. She just like made it look so easier, and she did it so easy, so easier. Like you will have a good question mindset, like how I would tackle these questions, what they are saying, or maybe I should reread. I got one habit from those videos, like the first habit that I've got it, that you should always go back to your question and read it again, because it will give you another kind of insight. And if it matches your first perception, then okay, you're gonna go with the question and answers. And even for the answer, she said always follow all those four answers. Don't say, oh, I know this question and I know the answer, and I just put a click on the answer without even bothering like why they are four, what the four are saying. So always uh, read thoroughly, if your answers as well and your questions as well. So read thoroughly all your options, all your questions stem. Sometimes it is a little bit complicated, but you're gonna find this easier later. And what else, like Mark Klimek, I also did Mark Klimek, and Mark Klimek was like angel of the nursing. I found his videos very perfect, very easy. He gave me another mindset, how you should see study. I don't know why our lectures, why our lecturers or our like teachers, they don't teach us like that. I don't know why. They should teach us like that, and it should be, it will be very easy for all of us. Like, oh, this question, oh, this topic, I remember. He he treat, I know, I can just it is in my mind. He taught aminoglycoside. He taught aminoglycosides drug class, and it was so easy that I can even remember right now. I can just tell you everything about aminoglycoside. What are the it is nephrotoxic, if it is toxicity to your ears, it is in the bean shape. Just remember that it, okay, it's gonna affect that, how neomycin, kanamycin, this and that, you will remember. So just follow his video, follow Dr. Sharon, and do your Archer or your UWorld, or do both, or I think that's okay for the exam. That's it. On I didn't go to the Saunders NCLEX, this edition, that edition, because I got bored while reading the book, so I didn't go for that. So I started the Archer, I started UWorld, and then Dr. Sharon, and then Mark Klimek. That's all. That's all you need to pass for this exam. That's it. And that is it for today's video. I'm going to share more insight. Comment down below if you have any questions regarding some questions, like how the question stem look like or something like that. If you have any questions regarding NCLEX, just comment down below. I will tell you everything, each and everything. And also I'm gonna comment, I will put the link of Mark Klimek's lecture in the comment box, because you will not find it on any kind of sources now. It is removed from everywhere. It is removed from Spotify. It is removed from YouTube. So, but I have those links as well. So I will share it with you guys. And that's all. I think that's all for this video today. And see you on the next video. Bye bye.